Hello everyone and welcome to another high yield USMLE question. Today this is going to be a 60-second question in the medicalized question bank. Today we're going to discuss cardiac pharmacology, so the pharmacology section of your cardiology. So we have a 65-year-old female presented to the office due to an abnormal lab test showing a severe hypertriglyceridemia. So the patient currently is asymptomatic and has a history of recurrent cholelithiasis. The physician did not prescribe fibrates, so that will be your first thought. So if the TGs are greater, triglycerides are greater than 500, then the first thought is give them fibrates. But because the patient has a history of recurrent cholelithiasis, which is a contraindication, gallbladder disease is a contraindication to fibrates because fibrates increases the risk of cholelithiasis further. And so this is why the physician did not prescribe the fibrates because of the history of cholelithiasis, but prescribed some other drug to reduce the TG levels. Now, the patient returns after a few days complaining of flushing and itching. So which drug is this? First, you need to know what the drug the physician prescribed, and it is niacin. So niacin can decrease TG levels, can increase HDL levels, and also reduce LDL levels. So reduce TG, reduce LDL, increase HDL. But one particular side effect that the USMLE boards, particularly for step 1, are going to test is the flushing and the itching. And the reason for this is because of the NSAIDs, because of the prostaglandin release. So the prostaglandins is the answer here. So the key points in this question are history of recurrent cholelithiasis, and that's the reason you did not prescribe fibrates. And another key point is the flushing and the itching that occurred, which tells us that this probably was niacin that was prescribed. So most of you are going to think about histamine as well, some of you, because histamine can also cause flushing and itching kind of features. But usually it's going to be with other drugs, like, for example, vancomycin cause non-IgE mediated histamine release. It's a direct mast cell release of histamine. The opioid drugs also cause a release of histamine that way, non-IgE mediated. These are non-allergic. And then leukotriene is the wrong answer. It's usually going to be in asthma, for example, cause of bronchospasm. Prostacyclins are also wrong answer. It can cause vasodilation, and it also going to prevent the platelet aggregation. The opposite of prostacyclin is the thromboxane A2, which is going to increase the platelet activation or aggregation and also cause vasospasm. Carcinoid syndrome is obviously a wrong answer. It's going to be serotonin release, and the serotonin is going to cause the flushing and the diarrhea, for example, tachycardia. So those are, and sweating. So those are going to be symptoms of carcinoid syndrome, which releases serotonin, and usually it's going to be a tumor. Most common location is the small intestine. So they're saying what is responsible for this. So here, like I already told you, it's going to be prostaglandin. So how do you prevent this? So you can prevent this by giving them any NSAID, especially, for example, you can give them aspirin or ibuprofen 30 minutes before niacin, and that's going to prevent the flushing and the itching. So that's going to be the answer here. So the right answer is A. So niacin causes PG release, which causes flushing and pruritus. So we give aspirin before niacin to prevent it. We can give ibuprofen as well. So it's important to treat severe hypertriglyceridemia, especially like if it is greater than 500, then fibrates are indicated. If it becomes greater than, if it goes beyond the 1000 level, then you are at excessively increased risk for acute pancreatitis, and that's what we want to prevent. This patient has a recurrent cholelithiasis that itself can also cause pancreatitis, but the triglyceridemia will also cause increased risk of pancreatitis. So in order to prevent this, in order to reduce the TG levels, we can give them fibrates. If fibrates cannot be used due to contraindication, like any prior history of pancreatitis or any gallstone disease, or liver or renal insufficiency, then we can give them niacin to reduce the TG levels. Hope this video was helpful, and if anyone requires tutoring, they can actually email us here at medicalize@gmail.com. We have tutors that can help you, definitely help you with all the USMLE exams. So I myself am a tutor. We have other tutors as well. So if anyone requires tutoring, they can email me at medicalize@gmail.com. Also, you can support the channel if you want more content like this. You can see our links in the description to support us at Buy Me a Coffee. And thank you for watching.